The menstrual cycle is a natural process that happens in the female body. It is a complex and beautifully orchestrated series of events that occur every month. It is a series of changes that prepare the body for a possible pregnancy. Each month, the body goes through a cycle of preparing an egg for fertilization. This cycle is controlled by hormones. These hormones are like the conductors of an orchestra, ensuring that each part of the cycle happens at the right time. These hormones act like messengers in the body. They send signals to different parts of the reproductive system, telling them what to do and when to do it. Think of your menstrual cycle like the changing seasons. Just as the seasons change from spring to summer to fall to winter, your body goes through different phases each month. Each phase is unique and important. The menstrual cycle has 4 main phases: the menstrual phase, the follicular phase, the ovulation phase, and the luteal phase. Understanding these phases can help you understand your body better. By knowing what happens during each phase, you can better manage your health and well-being. This journey of hormones and changes centers around the ovaries and uterus. The ovaries produce the eggs, and the uterus is where a fertilized egg would implant and grow. The ovaries are responsible for releasing an egg each cycle. This process is called ovulation, and it usually happens around the middle of the cycle. The uterus is where a fertilized egg would implant and grow. If the egg is not fertilized, the lining of the uterus is shed during menstruation, and the cycle begins again. The menstrual cycle begins with the menstrual period, often just called your period. This is when blood and tissue from the lining of the uterus leave the body through the vagina. The first day of bleeding is considered day 1 of your cycle. Menstruation usually lasts between 3 to 7 days. Flow can vary from light to heavy. It can change from day to day. For more educational content on health and wellness, make sure to subscribe to our channel. As menstruation ends, the body starts preparing for ovulation. This preparation phase is called the follicular phase. A hormone called follicle-stimulating hormone, or FSH, plays a key role. FSH is produced in the brain, in a gland called the pituitary gland. FSH travels through the bloodstream to the ovaries. It stimulates the growth of small sacs called follicles. Each follicle contains an immature egg. During the follicular phase, several follicles start to grow. However, only one follicle, sometimes 2, becomes dominant. This dominant follicle will release an egg. The growing follicle produces a hormone called estrogen. Estrogen levels rise as the follicle grows. Estrogen causes the lining of the uterus to thicken. This prepares the uterus for a possible pregnancy. Section 5. The surge of LH ovulation approaches. As the follicular phase progresses, estrogen levels continue to rise. This surge in estrogen triggers the release of another important hormone called luteinizing hormone, or LH. LH is also produced in the pituitary gland. It plays a crucial role in triggering ovulation. The LH surge happens about 24 to 36 hours before ovulation. This surge is the signal for the ovary to release the mature egg. Section 6. Phase 3. Ovulation. The release of an egg. Ovulation is the process of releasing an egg from the ovary. It happens around day 14 of a 28-day cycle. However, cycle lengths can vary. During ovulation, the mature egg bursts out of the dominant follicle. The egg is then swept into the fallopian tube. The fallopian tube is a pathway that connects the ovary to the uterus. The egg can survive in the fallopian tube for about 12 to 24 hours. Section 7, Phase 4, the luteal phase, awaiting a possible pregnancy. After ovulation, the empty follicle transforms into a structure called the corpus luteum. This marks the beginning of the luteal phase. The corpus luteum produces another important hormone, progesterone. Progesterone helps to prepare the lining of the uterus for implantation. If the egg is fertilized, progesterone helps support the early stages of pregnancy. Section 8. Hormonal harmony, progesterone's role in the luteal phase. Progesterone levels rise during the luteal phase. This hormone plays a vital role in preparing the body for pregnancy. Progesterone helps thicken the uterine lining. It also helps prevent the uterus from contracting too much. If the egg is not fertilized, the corpus luteum breaks down. Progesterone levels drop. This drop signals the body to begin a new menstrual cycle. Section 9. Symptoms and sensations. Decoding your cycle. Throughout your cycle, you may experience various symptoms. These symptoms are caused by the fluctuating hormones. Some common symptoms include breast tenderness, as estrogen can cause breast swelling and tenderness, bloating because progesterone can cause water retention and bloating, mood changes as hormonal fluctuations can impact mood, and cramps since prostaglandins, hormone-like substances, can cause cramps. Not everyone experiences all symptoms. Symptom intensity can vary from cycle to cycle. Section 10. The importance of tracking your cycle. Tracking your menstrual cycle can be beneficial for many reasons. It's not just about knowing when your period will start, but also about understanding your body better and taking charge of your reproductive health. It can help you predict your period. Knowing your cycle length can help you predict when your next period will start. This can be particularly useful for planning events, vacations, or any activities where you'd prefer not to be on your period. Identify irregularities, as tracking can help you notice any unusual changes in your cycle, such as missed periods or unusually heavy bleeding. These irregularities can be early indicators of underlying health issues, such as hormonal imbalances, thyroid problems, or even more serious conditions like polycystic ovary syndrome, PCOS, or endometriosis. Plan for pregnancy. Understanding your ovulation window can be helpful if you are trying to conceive. By knowing your most fertile days, you can increase your chances of getting pregnant. This information can also be useful if you are trying to avoid pregnancy, as it helps you understand when you are most likely to conceive. And manage symptoms. By tracking your symptoms, you can anticipate and manage them better. For example, if you notice that you tend to get headaches or cramps at a certain point in your cycle, you can prepare by having pain relief methods ready. This can also help you communicate more effectively with your healthcare provider about your symptoms. There are various methods for tracking your cycle. The calendar method, where you mark the first day of your period on a calendar. This is a simple and traditional method that can be very effective if done consistently. App-based tracking, as several apps are available to help you log your periods, symptoms, and other relevant information. These apps often come with additional features, such as reminders for when your period is due, predictions for your fertile window, and even tips for managing symptoms. And fertility awareness-based methods, or FABEMs, which involve tracking basal body temperature, cervical mucus, and other signs to identify fertile windows. These methods require a bit more effort and consistency, but can provide a wealth of information about your reproductive health. Educating yourself about your menstrual cycle can empower you to make informed decisions about your health. Whether you are trying to conceive, manage symptoms, or simply understand your body better, tracking your cycle is a valuable tool. Remember, every woman's cycle is unique, and what is normal for one person may not be normal for another. By tracking your cycle, you can gain insights into what is normal for you and seek medical advice if something seems off. In conclusion, tracking your menstrual cycle is a simple yet powerful way to take control of your reproductive health. It can help you predict your period, identify irregularities, plan for pregnancy, manage symptoms, and educate yourself about your body. So, whether you prefer a traditional calendar, a modern app, or a fertility awareness-based method, find a tracking method that works for you and start today. Section 11. Conclusion: Understanding your body's rhythm. The menstrual cycle is a complex and fascinating process that involves a series of hormonal changes and physical transformations. Each phase of the cycle plays a crucial role in preparing the body for potential pregnancy. It is a testament to the incredible capabilities of the female body, showcasing its ability to adapt and respond to various biological signals. This cycle is not just about reproduction, it also reflects overall health and well-being. Understanding your cycle can empower you to take control of your reproductive health. By tracking your cycle, you can identify patterns and predict when your next period will start, which can be incredibly useful for planning activities and managing symptoms. It allows you to make informed decisions about family planning, manage symptoms, and recognize any potential issues. For instance, knowing your cycle can help you determine the best time to conceive or avoid pregnancy. Remember, every individual's cycle is unique. Factors such as age, lifestyle, and health conditions can influence the length and regularity of your cycle. What is considered normal can vary widely. Some women may have cycles that are shorter or longer than the average 28 days, and that's perfectly okay. If you have any concerns or questions about your cycle, consult with your healthcare provider. They can offer personalized advice and help you understand what is normal for you, ensuring you maintain optimal reproductive health.